Hello, I'm going to now pick up from where I left. So we were talking about in the last video that how we'll be doing expectant management, and then for threatened abortion, we'll also ask the women to avoid strenuous physical activity. We'll also ask them to come for weekly pelvic ultrasound, and we'll also give anti-D to women who are RH negative. Okay, so now coming to treatment. Sorry for that bell. Okay, now if we come to inevitable, incomplete, and or missed abortion, right? Or missed abortion. So the management kind of depends. If it's uncomplicated cases, right? The management depends mostly on the patient preference. Possibilities include there can be expectant, all right, um, there can be medical, or there can be surgical. Okay, so let's first start with expectant. So this is an option for women who are less than 14 weeks of gestation, right? and and then, for example, there's a woman who is less than 14 weeks, and then we said, okay, let's day one, day one, um, she comes to hospital. We say that, okay, let's wait and watch. But for example, if it has been, okay, resolved or not resolved, right? um more than 4 weeks, yes. No, wait till 4 weeks. And more than 4 weeks, yes. So then you would go for surgical intervention, right? um you would want to go for that surgical evacuation. You don't want to keep something, in your body, right? It can be harmful, therefore we would prefer to go with this, right? If the baby is less than 14 weeks, the fetus is less than 14 weeks, the mom comes to you on day one with, maybe this diagnosis of maybe inevitable, maybe incomplete, or missed abortion. And then what happens is that you tell her, okay, you look fine, and then you are not in a bad condition, so let's wait and watch. You have waited for like 4 weeks, nothing is happening, then you would want to go for surgical evaluation. Now what's the other thing that can be done? So there is medical management as well. So in medical management, what you want to do is that you want to do misoprostol, right? Now what is, sorry, this pen doesn't show that much, right? Misoprostol, right, is basically used. So misoprostol is your prostaglandin E1, synthetic, right? Now what is it doing? It basically is used to induce cervical ripening, okay, cervical ripening. Or then what happens is that and expulsion of products of and expulsion of products of conception, right? And when available, pre-treatment with mifepristone 24-hour priors is recommended. Now what is mifepristone? It's basically a progesterone antagonist, right? And significantly improves treatment efficacy when compared to misoprostol therapy alone. So basically this is basically expulsion, right? It will make your uterus to contract and expel out the products. But then it said that 24 hours before mif, mif, miso, misoprostol, you can give give mifepristone, which is a progesterone antagonist, to basically help with the effect of misoprostol. Then coming to surgical management, let's just shrink this a bit. Okay, go. Oh god, 1 second. Okay, so if we talk about yeah, if we talk about surgical evacuation, right, surgical methods which is DNC, which is dilatation and curettage. And what is that? It's basically a surgical procedure in which cervix is dilated and tissue is removed from the uterus via a curette. So you should see how it's done. You can maybe watch a YouTube video, a small one, so you'll have a better idea. So it's basically, when is this used? So once we how, when, why it's used. So the thing is that it's a preferred method in septic abortion, right? And we'll talk about septic abortion in the coming videos probably. Or septic abortion, but I'll just tell you, okay, it's when there is product of conception which has been retained in the uterus and that lead to infection, right? So this, or maybe when there is heavy bleeding, right, or significant maternal disease, right? Complications include, obviously you're trying to, you know, use an instrument or something. So complications are, there might be uterine perforation, there can be hemorrhage, there can be, you know, you're introducing a foreign body there, so there might be, you know, some endometritis which might lead to uterine adhesions or something. And again, you should also give RH, you know, RHD negative moms should get anti-D. Okay, so do not forget that. And for example, there is complete abortion. For complete abortion, you don't really need anything really, no, nothing is required. And then confirm that cervical os is closed and the uterus is equal or smaller in size than expected for gestational age. All right, so there are some complications which I want to discuss. So septic abortion uh, is, you know, it's a complication basically of a missed, inevitable or incomplete abortion in which, as I mentioned, that retained products of conception become infected. Manage, how do you want to manage it? By surgical evacuation and using broad spectrum antibiotics. And there's also, retained products of conception might result in release of thromboplastin into the systemic circulation. And as you remember that this thromboplastin is basically a tissue factor which might lead to the activation of the coagulation cascade, and then it might lead to DIC, which is disseminated intravascular coagulation. And since you it can also lead to endometritis, right, which is like an inflammation of your endometrium. I hope that you liked my video, and it's a process and I'm going to learn and improve, right? And again, all these materials were taken from AMBOSS. It's a really good resource. I think you should definitely invest in it. Thank you so much. Goodbye from Teddy Learns 100.